Hi there, I'm Dr. Stephen Phelan. Welcome to this video. Today, I'm going to answer another question from one of my webinars. And this question is from my Master Your Case Acceptance webinar, which is basically A to Z training on case acceptance for comprehensive dentistry, whether that be veneer cases, implant cases, partial rehabilitation or full mouth rehabilitation cases, comprehensive dental cases, the bigger cases, so to speak. This webinar will teach you A to Z, my system that works obviously in an everyday general practice and has worked for me for over 20 years. So this question's from Dr. Ferraro, Lauren Ferraro, and this regards the case acceptance products that we use that I give for my Velocity Elite members, whether it be the keynote presentations, the before and after presentations of cases, or the Smile design and the different books that I give. And what Dr. Ferraro's wanting to know is, what if the patient asks if we have completed these particular cases? I'm concerned they will lose trust. And that's a good question because, some people might try to put this off as their treatment that they did. And then, it's hard to tell the patient that with a straight face. People can usually tell if you're not telling the truth. So from the beginning, when I started this program, I always said, always be honest with the patient. Tell them this is not your work. It's from a mentor that you're learning, because these are all occlusion design members. So they're learning how to do these treatments using my system. So just say, this is examples of treatment from a mentor that I'm learning from how to do these clinical cases. But he provided these pictures because I wasn't doing a lot of pictures for the last number of years. So I wanted to have pictures to show of cases that are similar to what I can do, but he provided them for us. And here's the cool thing. What you could also say is, the ceramics, the porcelain work in these cases is beautiful ceramics. And if you'd like, I can enlist this ceramist to do your case, because my members have access to use the ceramist that I use, Harold Heindel. He does work with a number of my members on specific cases they want to have just that really awesome result for. And so, all of the ceramics pretty much in this book are from Harold Heindel, and almost all of the ceramics on these keynote presentations and PowerPoint presentations are from Harold Heindel from the last 16 years. And as a member, you have access to using Harold for some of your really high-end cases. So what I encourage people to say is, this ceramics is from a very elite, special artistic ceramist, top ceramist in the world. If you'd like, we can actually use this ceramist to do your case. And that then really solves the problem, because you're just showing examples of that ceramist's work. So I think that that's a really good way to show your patients what can be done, but truthfully show them what can be done, because you can also use that level of ceramics as long as you schedule it out ahead of time with Harold. He's not like a quick turnaround lab. this is something you'll have to schedule out maybe a month or two ahead of time. And it will take longer to get the case back, because he's, not a big turnaround lab. He's 2 people. So it takes a while to get the cases back. You have to be organized. But if you're a member, and you follow our system, as long as you follow our system, Harold's very familiar with this. He'll work with you. So that's basically my answer to that question. Don't pretend it's your cases. Be truthful. Tell them that these are examples of what you can do. If you listen to the members' videos that I've placed on the results page, which I'll put a link to below this video, you can hear Dr. Brian Mitchell. He was asked by patients seeing the book, can you do this kind of dentistry? He's like, hell yeah, I can do that. I just don't take a lot of pictures, but I can do that. And the patient went ahead with, it was like a $60,000 rehab. I have tons of these stories, and it's just, I think the big thing is it's true. You don't do a lot of pictures, most of you, and you don't have this kind of collection of before and after photos like I do, but you can do this kind of dentistry. I've said this all along, you know, beautiful dentistry with precise fit and occlusion is not just for the gurus. You can do this kind of dentistry. It just helps to be an occlusion design member because then you'll learn all the systems that we use that work in an everyday practice. So if you'd like to look at my Velocity Elite program, if you'd like to see my Master Your Case Acceptance webinar, go to, let's say, the results URL this time. It's the phelandentalseminars.com/MCA-results, MCA-results. And that'll allow you to see what a couple of members say about Velocity Elite and using the photo books. And it'll also allow you to attend and hear my A to Z system for case acceptance. And that's basically it. So that's it for today. I hope you enjoy these webinar results videos. If you like these videos and you're on YouTube, hit subscribe to my channel. And also turn on notifications so you get an email when we release a new video. I'm trying to release more videos these days since I've set up a whole new video studio, so to speak. Pretty simple setup, but have some nice high-end equipment to make the videos look a little bit better and record them in 4K, which is pretty cool. I think that YouTube tends to like the 4K videos these days. So thank you very much, and we'll talk to you soon. Take care.